are approaching cold and flu season right now, and we want to make the distinction between respiratory illness symptoms and allergies, which can still occur this time of year. For more on this, we're joined by our good friend, family physician, Dr. Yvette Lu. Welcome and happy Friday.
Happy Friday. Good morning.
Now, I had a bout of sneezing the other day, of course, from indoor allergies. I'm not sure exactly what it was from, but that was the only symptom I had. So tell us, first of all, Dr. Lu, what are indoor allergies and what are the symptoms associated with them?
A lot of people think seasonal allergies can only happen in the spring and summer because of the tree pollens, but seasonal allergies can actually happen all year round. And in the fall and winter, when we're spending more time indoors, we start to see more seasonal allergies to indoor allergens like dust mites, pets, and mold. Allergies happen when our body sees a protein as being harmful, and then it forms an immune reaction against that protein. And the immune reaction that the body forms against that protein is very similar to how our body fights off viruses and bacteria, and that's why the symptoms are so similar. So with allergies, we can get a lot of respiratory symptoms like nasal congestion, coughing, wheezing, sneezing, sore throat, and you can also get symptoms in your whole body like itchy and watery eyes. You can get rashes or hives, headaches, fatigue, difficulty concentrating. In children, you can sometimes see slightly different symptoms. You might see them breathing through their mouth or rubbing their nose or clearing their throat. And sometimes in children, you can even see that they have difficulty concentrating or difficulty with schoolwork or difficulty keeping up with other kids in gym class. So allergy symptoms can be very disabling and can cause significant emotional and physical distress for people.
Okay, those are great symptoms to look out for, but where it gets complicated is a lot of them mirror the same symptoms we have if we have a cold or a flu. So how do we go about telling the difference between seasonal allergies and respiratory illness?
Yes, so because the symptoms are so similar, we have to be careful, especially at this time of the year. So if you have symptoms at this time of the year and your symptoms are similar to the symptoms you have every year at this time, then most likely your symptoms are allergies. If you have, say, an allergy to cats and your symptoms are always around cats, so if your symptoms are only around certain triggers, then your symptoms are most likely allergies. But if you have respiratory symptoms plus a fever or muscle aches and pains throughout your whole body, then most likely you have a viral or a bacterial infection, and then you need to talk to your doctor or healthcare provider and maybe talk to them about getting a COVID test.
Okay, now as we get into the cold and flu season, we want to protect ourselves and maintain our health properly. So with respect to allergies, what's the best thing that people can do if they think they have them or they are suffering from them?
So the first thing that's important to remember is you want to find out if you actually do have allergies. So you can talk to your doctor about getting allergy testing. And then once you find out what you're allergic to, then you can avoid triggers. For example, if you find out you're allergic to dogs and you have a dog, then you can start by brushing your dog off regularly outdoors to get as many allergens as possible off the dog so they don't shed the allergens all over your house. If you continue to have symptoms that are disabling, or if you're unable to avoid triggers, then you can try taking an oral antihistamine medication like Reactine, or you can try taking a more local medication like a steroid nasal spray or an antihistamine eye drop. And then if you want a longer term treatment, then you can talk to your doctor about getting things like allergy shots or other therapies that are similar. And then the last thing is I recommend that everyone get their flu shot this year, because that will reduce your chance of getting the flu, and then you won't have to worry about confusing the flu and allergies.
And then just generally some other tips to help us avoid getting that cold or flu this season. What else can you pass along to our viewers?
Yes, so everything that we're doing to avoid COVID is very similar to avoiding respiratory illnesses. So washing your hands, we're already physically distancing for COVID-19, so physical distancing does actually help with cold and flu as well. And then not touching your face. So everything we're doing already will also help you avoid the cold and flu that you can get during this time of the year.
Yeah, it seems like a lot of common sense stuff, but we always need that little reminder, and that's when we look to you. Dr. Lu, thank you so much.
Thank you. Take care.
Have a wonderful weekend. That's family physician Dr. Yvette Lu coming up.